What is your best option to improve your medical practice's risk adjustment factor score? Team up with your risk adjustment coder. Lesson objective. Healthcare providers will learn why having good coders is the smartest choice and what their coders should know to be great risk adjustment coders. In this module, we will cover the following topics. Why physicians need experienced and certified risk adjustment coders. Limits of risk adjustment coders. What medical coder should know to be a great risk adjustment coder. How risk adjustment coders can query healthcare providers to improve risk adjustment factor score. Why healthcare providers need an experienced and certified MRA coder. To improve medical record documentation and coding practices, physicians and other healthcare providers should consider the following suggestions. Use an electronic medical record system. Confirm that all diagnosis codes are included in the claim submission. Provide full and accurate documentation to ascertain that diagnoses are supported. Use updated coding books or software each year. Make sure the practice management system is kept updated. And use a certified coder. The significant difference between regular physician office coding and risk adjustment coding is that physician office's primary focus is usually the patient chief complaint. In contrast, risk adjustment coding emphasizes both the chief complaint and chronic conditions of the patient. Why? Because chronic conditions affect the patient's overall health status, resource requirements, and decision-making about the chief complaint. The documentation in the medical record is essential for coding and reimbursement. Documenting a patient's chronic condition is essential since, if not reported annually, it indicates the condition is resolved and no longer exists, leading to an inaccurate depiction of the patient's health status and inaccurate risk adjustment score set by the payer. Consequently, there will be underpayment and limited resources toward the patient's care. Unfortunately, sometimes the physician may intend to document that a chronic condition is ongoing but note the condition as history of. An example is history of COPD. COPD represents a chronic condition that is generally managed by continuous medication and has the potential for acute exacerbation if not appropriately treated. This is where the risk adjustment coder becomes part of the team as the best response to such a situation. When a chronic condition is documented as a history of, it raises a red flag. The risk adjustment coder will query to ensure the physician intended to document the chronic condition as a history. A good risk adjustment coder knows that it may be acceptable to code a diagnosis when it is documented as history by the physician if the diagnosis can be validated as chronic and incurable, and the diagnosis can be supported in the physician notes by the MEET strategy. As a healthcare provider, your role will be to make CMS aware of all patients' conditions and illnesses. This task will be easier when it is about reporting chronic conditions. In Module 2, we learn that finding new MRA diagnoses is one of the best ways to improve risk adjustment factor scores. Finding new conditions can be a little bit challenging considering you have to read all the reports such as labs, imaging tests, pathology, consultation, hospital record. Healthcare providers often get focused on curing and healing and give less time for documenting. Since you have to concentrate on patient care, we realize it can be difficult, even impossible, to find the time to read a 60-page hospital discharge report. That is why you will need the help of your risk adjustment coder, who will manage to read all reports and let you know about chronic conditions you forgot to document, new risk adjustment diagnoses found in the reports, documented conditions you did not support, and specific code you should use. If a healthcare provider's documentation is inaccurate and incomplete, proper reimbursement will not be obtained. Therefore, the coder must evaluate the documentation for completeness and accuracy and communicate regularly with the healthcare provider to ensure required documentation guidelines are met. Query the provider to obtain more information is an important link. The information obtained from the queries will assist in clarifying discrepancies and making it possible to report services performed and ensure fair compensation accurately. Risk adjustment coders can help healthcare providers realize things in the documentation they need to include, which helps with reimbursement and helps patients' treatment.